Inflation and rising costs continue to affect us from the grocery aisle to housing and medical care. One Dallas-based medical practice has made improving patient care and outcomes while reducing costs its mission, and now its value-based model is getting national recognition. Dallas Nephrology Associates CEO and President Dr. Alexander Lang is here to tell us all about it. Good morning.
Good morning. Thank you for having me.
So glad to have you. Okay, so tell me a little bit more about the recognition that Dallas Nephrology Associates is actually getting and who awarded it.
Yeah, we're pretty excited about it. So in 2024, we received the RPA Practice of the Year Award.
Wow.
And so one of the exciting things about DNA or Dallas Nephrology is that we've been doing a lot of good work in our area, taking care of our community. The RPA is an organization that represents all of the nephrology professionals in the country, as well as the nephrology practices. Wow. And so what we've done over the last few years is really pivot caring for patients in a way where we're trying to keep the patients healthier and saving costs to the system, because you know that healthcare has been sort of challenging lately. So we call this value-based care. That's what we've been doing over the last several years.
Can you expand a little bit more on exactly what value-based care is?
Absolutely. And so if you think about how expensive healthcare has become around the country, our particular population of patients are patients who really require a lot of sort of help from physicians, from hospitals, from different systems, dialysis clinics. So it's all pretty expensive. What we've done with value-based care is really focus on how can we keep these patients healthier, out of the hospitals, out of the ER. And it's challenging because for us to be successful, we have to do a lot of coordination of care. Trying to make sure that everybody has their medications, they're all seeing their doctor, all of that. So.
Doing good work sometimes comes with those hurdles. Any other challenges when it comes to value-based care?
Absolutely. I mean, if you think about, a sort of physician practice, right, like we are, it requires a lot of dollars for us to create an infrastructure to be able to provide that sort of care, right? We have to hire extra nurses, we have navigators, a variety of different support staff that really tries to reach out to the patients and make sure that they get everything that they need and that they're staying healthy.
And those are the most important people to the patients. Those are the frontline workers. Those are the people that they see every time they come in. So they are also really important.
Absolutely.
Can you tell us more about because you guys have really honed in on this value-based care. So can you tell me more about the manuscript that your group has actually published about it?
Yeah, so we're excited about that too. So we decided that, we've learned a lot over the last 5 or 6 years in value-based care and kind of figuring out how to go about setting up a population health department, all these things within the practice. And we've wrote it all up. We've written it all up in this article that was published in the American Journal of Managed Care. And so we're really excited about it, and we hope that people can learn from us.
Yeah, you guys are constantly evolving and making waves.
Wow,
I mean,
the
American Journal, that's quite the feat.
Absolutely.
In the ever-evolving healthcare landscape, how do you plan to be a leader nationwide when it comes to nephrology?
We have to continue to look outside the box, right? And we have to continue to innovate, think about new ways of caring for patients. We really, really want to try to keep patients off dialysis if we can. And then in many ways, we want to, be a resource for other practices around the country to make sure that everybody else can do the same things we can. So.
Well, it sounds like you are on the right track. Congratulations on all your success. I'm sure everyone in the North Texas community who benefits from you are just ecstatic at the work you guys are doing. So thank you again for being here.
You're welcome. Thank you so much.
Dallas Nephrology Associates has been treating kidney patients for more than 50 years, has more than 100 healthcare providers and 38 area locations. All you have to do is call 214-358-2300 or 877-654-3639 for more information, or you can just go to DNEPH, that's DNEPH.com. Again, if you would like to learn more, you can also scan that QR code that's on your screen right there.